everyone, this is your host Irsa Khalid and you are watching this program by DiploTV. Today we have a very special guest with us. He's Dr. Muhammad Adil Khan. He's a healthcare professional, he's a UK trained physician and is working for over 17 years now. He is a consultant physician at Dr. Arshad Health Associates and is working in the areas of family medicine, aviation medicine, internal medicine, and occupational health. So let's get into discussion with him and let's explore the dynamics of health and diplomacy together. So Dr. Adil, greetings to you. Thanks for your time. We'll start with your personal journey first. Tell us about yourself, your ambitions and your motivations when you were a teenager maybe, and why you dreamed of becoming a doctor, a physician.
So thank you very much, and it is an honor and a pleasure to be with you today and speak to you on this topic. I started my journey initially because I had a family of doctors. My father was a doctor, and that's what generated interest in going into medicine. I did my initial basic medical school in Pakistan in Rawalpindi. And then after that, I worked here for 3 years in the private sector. I did my internship in the government hospital. And then I thought that I must proceed abroad to undertake training. And I've always been interested into flying. And that was one of the main reasons that interested me that I should do something with flying and medicine. So that is one of the areas and reasons why I subspecialized and did my postgraduate training and courses in aerospace and aviation medicine. If I was not a doctor today, I might or would have been a pilot.
That's great. So speaking of becoming a pilot or interest in flying, you chose for aviation medicine. First of all, please tell us, our audience, that what it is and how significant it is and what do you do in that domain?
So thank you for this question. So aviation medicine is an area of my special interest, and as I work as an occupational and aviation health physician. Occupational medicine, relatively new concept in Pakistan. It's the interface of health and well-being along with the job role and various occupations. So the interface of work with health is occupational medicine. And you know that there are a lot of human factors involved in aviation medicine. It has to do with health and its effects on an altitude. And it is basically, there are two aspects. One is the regulatory aviation medicine, which includes the fitness of cockpit crew, pilots, and air hostesses, the crew that flies with airlines, or any other sort of private charter planes or even sort of flying clubs. And then the second aspect is the non-regulatory side, which includes medical evacuations, working as a doctor escort, and also ensuring that people are safely transported from one place to another. And it also includes sort of retrieval and remote medicine. So it has to do with aviation as well, as long as air ambulance work, etc.
What is the difference between UK and Pakistan in healthcare sector?
So UK has got a very well-established healthcare system and a very robust healthcare system. It is classed as one of the best in the world. They have a very well-established primary, secondary, and tertiary care healthcare system. And they're all guideline-driven. There are robust policies, guidelines, and they're all evidence-based. It has been there since many, many decades. There's a long history over there, and it is certainly, classed as one of the best in the world. Specifically, their training is quite robust, quite extensive, and gives you a wide and varied exposure to various pathologies. On the contrary, Pakistan does have a very well-established healthcare system. Things are improving and it is very good, but I feel that the improvement is considerable as compared to the last 12, 13 years. So we have come a long way and there is improvement. However, there is always room for more improvement.
Right.
We need to increase our work around regulation and patient safety. Communication is one very important aspect. Patient communication is the key, which I feel based on my own experience, lacks over here. We don't spend so much of time and sort of energies in training doctors on communication skills. So I think that is extremely important. Things are improving in the medical schools now, but there's certainly more to do.
So, speaking of communication, as you have just mentioned, and in medical schools, the students are being taught about this whole, anatomy of human being and the concepts, these, difficult concepts to understand their profession. But do you think that there's a gap between in these schools when they are being taught about this coursework? They should be aware about what are soft skills, what is empathy, how to communicate with your patient, how to understand their dynamics, their backgrounds. So, what are your thoughts on this?
So, spot on. Thank you for asking this question. It's very relevant. So, you've mentioned empathy. Absolutely. So, communication skills, sympathy, empathy are the key in providing good quality care to our patients. Now, personally speaking, having gone through this journey, I felt that the emphasis on communication skills at that time was not enough. Whereas when I went to the UK, alongside the technical skills and the technical expertise and medical training, communication skills are being looked at very importantly. And they do throw a lot of weight on communication skills. In fact, even postgraduate exams and their undergraduate exams are marked on communication skills. So communication skill is the most important, one of the most important aspects and tool between a doctor and a patient relationship. So it is extremely important. In Pakistan, the medical training is excellent and it is robust. And I felt that having initially trained here and initially undergone my medicine here, doing my postgraduate exams and conceptualizing the evidence base of medicine was relatively easy. However, soft skills were not concentrated upon as they should have been.
And they're not integrated in curriculum.
At the time, the integration is there, but the practical application is relatively was less at the time, but now things are improving.
Okay, right. So you have studied in UK and then you went back to Pakistan. Why haven't you, most of the professionals prefer to stay in the countries like Europe, specifically health professionals, because of the obvious reasons as you are in the field.
True.
So why you chose your home country instead of some good, European country?
So again, this is a very important question and something I'm asked quite frequently. Ever since I did medicine, I wanted to come back to Pakistan. I always had this itch that I would want to come back to my own country. I had this in mind, although being very well settled in the UK, working in the NHS, which is the National Health Service, which is a public health service, and also working in the private sector, being very well settled, I still had that enthusiasm or thought and intention to come back to my own home country. As a worst case, I thought maybe I'll just go, I'll try my best, and then if I don't settle, I'll return back. However, I think since the day I've come back, I feel more and more inclined and involved into the healthcare system to give something back to our people, to the community, to the masses, while we are working with local corporate clientele, international community, and also the diplomatic community. At the same time, we have a parallel arm that is working on community development, and we are providing free healthcare to the underprivileged. We're running camps, we're providing free services to those who cannot afford high quality medicine. And the key and the most important thing which gives me satisfaction is everybody receives the same level and quality of care. So that is what keeps me going.
Yeah, this is your drive.
Absolutely.
Okay. So as you have just mentioned about serving in undeserved areas and remote where the healthcare systems are not well established. So everybody knows about the challenges. I want you to point out the solutions. What can be done in that domain? And there are people who does not have basic, healthcare facilities. Like as a woman, I would say sanitary pads are not available or proper education how to handle this stuff.
So this is again a very valid question. However, the answer we can just go on and on talking about this for long hours. So it's a very long winded answer. Not a very simple answer. However, all I can tell you is that in Pakistan, things are improving considerably. the government is doing a lot of work. They have devolved healthcare, and I think there's more devolution that needs to be undertaken. The healthcare needs to be properly devolved from top to bottom. There should be a far-reaching impact on the masses. The government is doing, but we are an overpopulated country, and that certainly cause an impediment or a barrier to provision of healthcare services. Secondly, there are a lot of non-governmental organizations and international organizations that are also working in partnership with the government. There are public-private partnership schemes, etc., that are providing these services. So I would say that if I look at it and compare 10 or 12 years ago, things have considerably improved, but we're not yet there. There are still areas, especially in interior Sindh and remote parts of Balochistan, where healthcare provision has not reached as yet. I mean, it is there, but it's very patchy. And we don't have a one fixed solution for this problem. I think all of us just need to try. The government needs to continue and try and provide these services. And I feel an important aspect is population awareness. I think education and awareness is the key. Once we make them aware, once we educate them, and they understand healthcare issues, limitations, challenges, they will then seek out and get appropriate healthcare assistance if and when required. This also includes population control and basic sanitation, etc., and preventing against communicable diseases that are considerably rampant in these areas.
Health diplomacy, how do you perceive it? And please enlighten us to our audience about this concept.
So it's a very interesting concept, and health diplomacy involves health promotion and protection of human life and health and well-being beyond borders. If you look at it from our local perspective, I don't think we can achieve high health outcomes without cooperation and collaborations. And in Pakistan, there's so many international initiatives and programs that are being looked at in collaboration with international organizations and various other countries to strengthen our country's internal healthcare systems, which also includes addressing the challenges that we face, like, for example, overpopulation, health awareness, mental health, reproductive health. Along with that, we also, climate change is a very important factor in all these things. So I feel that these challenges that these situations bring along cannot be solved by doctors alone, and there has to be some cross-border international collaboration with stakeholders, organizations, and other countries to strengthen the backbone of our healthcare service provision, which also includes primary, secondary, and tertiary care.
So do you think that physicians and doctors can bridge two countries and play their role as peacemakers in the peace building process?
Absolutely. I feel doctors certainly, or healthcare professionals per se, can play a very, very positive role in this. And as I mentioned earlier, that we cannot do this on our own. You need cross-border collaboration, and doctors cannot do this on their own again. It has to be a larger initiative, movement, and various programs that need to be implemented, where we can certainly improve healthcare outcomes, and in the process, work for the healthcare of our own country and work with other countries, and act as a bridge.
Yeah.
And as a stopgap.
So in our country, if I talk about Pakistan, so mental health is still an issue. Addressing it is an issue, and there are a few superstitions that are attached to it and stigmas as well. So would you tell about this to our audience, that how much mental health is significant and how much normal it is to talk about it, and if someone is not in good condition, how much it is important that they should consult the professional?
This is a very, very important topic, and it is very close to my heart, and I have a special interest in mental health. I feel mental health is still a taboo locally in our country, but even globally, it's not something that we easily talk about or open up about. And I personally feel that there needs to be more awareness and education, patient education, on more about mental health, anxiety, depression, and various other manifestations of mental health and disorders, where people can identify issues early, seek early assistance and help, consult with a appropriately trained healthcare or medical professional, and start treatment accordingly. There is so much we can do to support mental health and well-being. However, I feel there is lack of awareness and it's not recognized as it should be. In the post-COVID world, I have seen a lot of patients who are presenting with mental health problems, and certainly internationally as well, I've seen that mental health problems have increased considerably. The key is to recognize and seek early assistance. Locally, considerably, I totally agree with you. It is a big taboo, and there is a lot of reluctance in opening up or for people to recognize the problem and to seek appropriate assistance.
Do you think the excessive use of technology and everybody's on their phones, and that's why it could be a reason leading to a mental health issues? At the same time, it is another question. The other part of this question is that how do you see AI and the healthcare systems?
Both very valid questions
Yeah.
and very important. Um, to answer your first question, mental health, I feel certainly using screen time, phones, smart devices, etc., can have a negative impact. Everything needs to be done in moderation, and excess use of digital devices, etc., can have counterintuitive and counterproductive effects. However, it they have their own advantages and merits, and they've made our life much easier. There's a cross-border transition and exchange of knowledge. Resources are easily available, and without technology, I now feel that we're absolutely incomplete, and it's extremely difficult to operate. But I feel that it needs to be tightly regulated and controlled, and this is more so especially in the newer generation, the younger lot, the children. I've seen they're addicted to screens. They're using sort of iPads and iPhones, etc., and that does have disastrous consequences. And I think it's important for them.
Biologically, how do it affect them, like screen time?
There's the data so far is extremely limited, but there is data that it does interact, the rays and everything does interact with the brain, etc., and causes harmful effect. It does cause a lot of effect on mental health. Eye strain is one issue. A lot of visual problems that are presenting because of excessive screen use. And at the same time, the content that they watch on the media, that has disastrous effects. It's unchecked, it's unregulated. If there are lack of parental controls, and especially more in the younger lot and the children, it can be very, very counterproductive, and it does have negative adverse effects on mental health. And I have seen quite a few children who are sort of browsing the internet, going on social media, etc., and then presenting with all sorts of negative influences.
Right.
And they manifest in their day-to-day life, and they are also coming up with various mental health problems, and it also does impact other conditions like neurodiversity, etc.
How is AI impacting the healthcare field?
So to answer the second part of your question, I personally feel that AI is an extremely useful tool, and we can use it as an aid for clinical management and day-to-day use. However, we should not rely on it, because there is evidence and data that it does have harmful effects on health and well-being. The information is not regulated, and there is no guarantee that the information that is used by the layman or by the general public is accurate and authentic. There is so much of information available, information overload on Google and even other sort of AI platforms, that it is extremely difficult to say which is the right information and what is not the right information. However, I feel that AI and all these tools can be used as to assist, but they cannot be replaced by healthcare professionals.
Yeah. And they're quite misleading as well.
And doctors, and certainly they are very misleading.
Yeah. You have been in a few leadership roles during your career. So, what are the top 3 qualities of a leader?
I feel that a leader should be sympathetic, empathetic, inclusive, need to include their team in all decision-making processes. Team working is extremely important, high emotional intelligence, and at the same time, it's extremely important to be kind. That's I feel is quite important. And lastly, I also feel empowerment is important, empowering your team and providing them with responsibility. That's extremely important. And I think it's a good virtue of being a good healthcare leader.
And lastly, what advice would you want to give to people specifically in healthcare and younger generation, and also for our platform, DiploTV?
So I think the key is that for the medical professionals, I feel they should continue with gaining knowledge. Medicine is all about learning. Knowledge never completes. It's important to be humble and live with humility, and at the same time be open to learning and be open to change, and reflect on your own practice. That's extremely important. I feel that every day is a learning experience and every patient is a new patient. So anything new that we learn should be appropriately inculcated in practice. And there is a small saying that I would want to say. It says a wise man learns from other people's mistakes, whereas a foolish person would learn from his own mistakes. So my view is to learn from other people's experiences and mistakes and inculcate that into your own practice so that you don't do the same mistakes.
That's $1 million advice. Thank you so much, Dr. Adil, for your time. It was a very insightful interview. Thank you so much.
Thank you very much. Thank you.